move it. You can start your presentation.
Okay, I'm Ikobo Michael Ime. My topic is comparative study of patient satisfaction with the services of public and private hospitals in Uyo, Akwa Ibom State. Patient satisfaction has become a central health quality measure because it reflected whether care met expectations and supported adherence, continuous use, and trust. Public hospitals promoted access but often faced overcrowding, overfunding, weak infrastructure, and delays, while private hospitals offered responsiveness, amenities at a higher cost. Nigeria's dual system retained limited insurance and heavy out-of-pocket payments. So comparing public and private experiences in Uyo therefore required localized evidence. Statement of the problem. Uyo's public hospitals were associated with long queues, overcrowding, unreliable amenities, scarce supplies, and overworked staff, despite remaining essential sources of affordable care. While private facilities appeared cleaner, faster, and friendlier, but higher charges threatened healthcare equity and could generate serious household expenditures. Because local contracts remain largely...
Well done. Well, I think I like your introduction, but just move on to your aim and study objectives.
Okay. The aim of the study is to conduct a comparative analysis of the levels of patient satisfaction with healthcare services provided by public and private hospitals in Uyo, Akwa Ibom State.
Oga Michael, I think, I don't know if I've seen this, but the objectives are not looking like what I've seen. You see, there are ways of stating your specific objectives in a comparative study. To assess and compare. To assess and compare. To assess and compare quality, patient satisfaction with healthcare service provided in this. So to assess and compare, that is how you are going to state both the aim and the specific objectives.
Okay.
Yes. How are the different ways you assess satisfaction, patient satisfaction? Once you state different patient satisfaction is what they call a construct, made up of, it's a building made up of different parts. How do you assess patient satisfaction?
I adopted the service quality model.
So it has different domains now. What are they?
They are reliability, assurance, tangible, empathy, and responsiveness.
So you can include them in your specific objectives.
Okay.
Yes, you can. But because once you state patient satisfaction, it has ended though. Which means there are specific objectives will now become. Or if you want to have two specific objectives, then you can say to assess and compare patient satisfaction with healthcare services in public and private hospitals in Uyo, Akwa Ibom State. And then the next one will be to determine the factors, to determine and compare the factors associated with patient satisfaction with health in public and private hospitals in Uyo, Akwa Ibom State. So, which one do you choose? Do you want the two, or do you want to break them up into the various? You can just do the two. Just take the two, sir. Take the two. So these socio-economic and this are all into the patient factors associated.
Okay.
Okay.
I should proceed.
Yes, but just note the correction in the specific objective. So go to your methodology. Study area, Uyo, the healthcare, of course, health is in the concurrent list. Now everybody can take part. Comparative study. Okay, move on to the next.
What a drink.
Okay. Study population, private and public hospitals. Hmm?
Yeah.
Okay. So since it's a comparative study, it's technically two studies in one. Yeah?
Okay, sir.
So you can technically have two sets of inclusion and exclusion criteria. Eh?
Okay.
Please note, you are assessing the hospital, so not the patients. Did you get that?
Yeah, I get you, but it's not very clear, sir.
No, although is the patient satisfaction, but the people, the study, you are assessing the quality of services in the hospital, but you are using the patients as a as an indicator or as the
Okay.
respondents.
I
Okay.
understand, sir.
So taking, and we said it's a comparative study. So technically, you can have two inclusion and exclusion criteria. So what are your inclusion criteria for public hospitals and your inclusion criteria for private hospitals? Eh? And then
Okay.
when you have established that, now you can now talk about their patients. What kind of patients are they referred or inpatients or outpatients or all the patients?
Okay, sir. Yes, sir.
I don't know if you got that.
Yes, I got it now.
For example, the private hospitals, which ones are you going to include? Will they be the ones that are licensed?
Okay.
So that's why it will now, for you to, is actually better to separate, since it's a comparative study, separate the have two inclusion and exclusion criteria so that they are better addressed.
Yes,
I
sir.
hope you understand that.
Yes, sir.
Okay, and you will do that.
Yes, sir.
And
I'm
since
taking it down.
so that is what I expect to see when you bring this thing for the final correction. So
Okay, sir.
move to the next. Move to the next. Okay. No. Sample size. Oh, Ogamo.
Yeah, Prof.
Yeah. Okay. This one is for comparing proportions.
This for comparing proportions, yes.
Okay, that is good. Okay. So, Michael, just move on to the next.
Okay.
You are sampling. Okay.
I use multi-stage sampling.
That's you're 2 months so you're 2 months. You have not sampled anything. No. This one is purposive, and we don't like purposive, but don't worry.
Okay.
Don't worry. You did it in UUTH and St. Luke's. Okay.
Yes, sir.
And private. Okay. What will you classify St. Luke's? It's public, eh?
Though not so public. It's a religiously affiliated healthcare public institution. So it was the most fitting to pair with UUTH. That's why I used it.
No, that's no, this one public health. Public health. You know the definition of public hospitals?
It should mostly be government funded.
Yes, it's funded, government funded, and then private. Or you can also stratify. You can even not for profit.
Okay.
Not for profit. So which means that you have to okay. Anyway, because of your results, you consider the St. Luke's as a public, eh? Was
Yes,
it?
sir.
Okay, I hope that is what you did.
Yes, sir.
And we said the comparative studies are two studies in one. let's go back. Let's see a minimum sample size. You see, okay, sir. You see, a minimum from what you have calculated, your minimum sample size is 252
each group.
for each group. So for
Yes.
private and for public.
Yes.
So move to the next slide, which means between St. Luke's and UUTH, you are supposed to have a minimum of 222, is it 225? Which one? I don't forget now.
252.
252.
Yes, sir.
And then the private, between Life Care and Gateway, you are supposed to get, okay, you have done that. Okay. So, but this is not the sampling method we taught you, eh?
Okay.
So multi-stage. Multi-stage. So we are going to stratify the hospitals in Akwa Ibom.
Okay.
In Akwa Ibom into public-private. And they are choosing two public, two private.
Okay, sir.
And for two public, now that is how you chose UUTH and St. Luke's. And then
okay.
for private, you have chosen those. Okay.
Okay, sir.
Okay. So stage 2 will be the selection of respondents. The selection of respondents from the hospitals.
Okay.
Using a systematic sampling method. But first of all, we are going to do it in at least 2 steps. The first step is to proportionately allocate the number of questionnaires to each of the selected hospitals. And I'm sure that is how you got this 2-to-1 and equal for this thing.
Okay, sir.
So you can use a 2-stage sampling method. But you have to, when you are doing, because of how you selected, you put St. Luke's into the, you have to go and add it. Add that criteria.
Of not for profit.
That made you, no, because the comparison is between public and private. So add those not for profits into the public.
Okay.
So you include that in your inclusion criteria.
Thank you, sir.
Inclusion criteria for public for hospital facilities. Okay, so move on. Okay, okay. So this one now, these are validated questionnaires, and they also tell us how. They also tell us how to analyze them.
Yes, sir.
Yes, they told you how to analyze them.
Yes, sir.
And data analysis, you should actually state them.
Yeah, yes, sir.
Okay. So, and then you have not told us the patients, respondents, were they outpatients or inpatients or all the patients?
Okay, you've already commented on that in the conclusion, so I will update that in my next draft that I'm sending.
Okay. So move on. Okay, move on. Response rates. That's a common mistake made by people. When you are doing a comparative study, there are just 2 studies in one. 2 studies in one. Okay? 2 studies in one, eh?
Yes, sir.
So the response rate will be for the public and the private differently,
okay, sir.
not together. Don't add at any point, don't add the two together. Okay, so let's move to the next. Madam,
I should do the same here now.
okay, you know, analyze this thing well.
I think I will still separate it.
You combine them. No, just move on. Okay, and these things, let the satisfaction, let's present them according to the domains, and then compare them, public, private, and then.
That's the third objective that compared.
No, they are done together now. They are done together,
Oh.
especially in a presentation like this. They should be together because you want to establish the difference, not separately like this. And it's just move.
This is.
So we don't even know. This is probably what you are going to. But
Okay.
in your dissertation, please present them separately.
Okay, sir.
Tangible reliability, and at the end, this overall will now stand out.
Okay.
So this one now, what will you say now? So in terms of the overall patient satisfaction, what are you going to say?
It's generally better for all variables, all variables in private hospitals.
Yeah, presentation. I hope you calculated the p-value. This one where
Yes,
they talk generally better. You talk there, just say that statistically significant difference in patient satisfaction.
Noted, sir.
That is how scientific things are presented, though. Not generally. Just no. Even if there is a difference, but if the difference is not statistically significant, there is said to be no difference. Okay, move on. These factors associated will usually cross tabulations. Okay. I hope you have them as cross tabulations in
my main work, yes, sir.
Your main work, cross tabulations. And why you can't get this hospital type? Is it not your main comparison?
It's my main comparison.
Okay. Move on. Okay. Readiness. Okay. It's all right. Just move on. Okay. At the end now, it didn't tell us now which one is which one overall. Overall, which one do you think?
My conclusion carries that.
Let's see your conclusion. But your specific note your discussion. Your discussion is to compare and contrast with the findings of other studies, and then explain the differences or similarities. That's how discussions are carried out.
Okay, sir.
Okay. So, move on. Go to your conclusion. Let's see. Okay, experience in no. Your conclusion. Your conclusion is which one is better?
Okay.
Which one is better? And which you can say the conclusion is which one were the patients more or statistically more satisfied with their services. And then you can, if you want to state further, you can now talk about the different domains that they are better.
Okay.
Even in your introduction, you were saying that private hospitals are more expensive, but they provide, they are more responsive. Why the private hospital? So those, based on the domains, you can now state which ones are better in each of those domains, and then you talk about the overall satisfaction.
All right, sir.
Okay. Okay. So, Dr. Moore, do you have any other comments? Okay.
No
Dr. Moore.
comment. No comments.
Okay, thank you.
Thank you, sir.
You may just make those corrections, so please,
All right,
please.
sir.
Please.